I'm John Cheville, a pathologist here at the Mayo Clinic.
I am George Vasmatzis, a bioinformatician here at the clinic.
A biomarker really is, in a sense, a very broad entity. It can be a gene, which is part of a chromosome. It could be a change in that gene, a mutation, or it can be an alteration in the product that that gene produces. And those alterations we can detect and may guide us in diagnosis and choosing appropriate therapy or determining how that tumor or disease will behave. It also includes imaging modality, x-rays, radiographs, what we think of, that new techniques in imaging radiology can use biomarkers in diagnosis. Biomarkers can be used in a number of areas in medicine. It can be used in early detection of disease, where it's maybe more adequately treated, caught early. It can be used in the treatment, identification of specific targets that can treat a disease. It can be used to determine how a disease will progress or whether it won't progress. And it can be used in terms of determining a response to a particular therapy. So there's a number of areas where a biomarker can be used in medicine today.
What we're trying to do is look at clinical dilemmas, and we're trying to find biomarkers around those clinical dilemmas where they can help doctors make decisions for these patients better than what they have at the moment. Well, what we'd like to do, first of all, is set up a complete team, which includes clinicians and pathologists who know what are the right clinical questions in a disease area. And they lead the team. They bring together molecular biologists, bioinformaticians, biostatisticians, clinical laboratorians who can now set up a whole pipeline to start from the question, the design of the study, to through the discovery pipeline to find the biomarkers, validate them, and then develop tests related to those biomarkers. We have found that there is a lot of big potential here in the clinic for this type of approach. Mayo Clinic is a very team-oriented clinical institution, and we think that the same team orientation can work very well in research and biomarker discovery.